6 warning signs of a silent heart attack that you shouldn't ignore. Hello. Did you know that between 20 and 45% of heart attacks are silent? That's right, it's more common than many people think. When we talk about a heart attack, what usually comes to your mind? Most people picture those dramatic scenes we see in movies, someone clutching their chest, struggling to breathe, until they collapse or something even worse happens. But don't believe everything you see in the movies, because it doesn't always happen that way. A silent heart attack presents very subtle symptoms, almost imperceptible or sometimes even no symptoms at all. This means that, yes, it is possible to suffer a heart attack without realizing it. And that is why it is called a silent heart attack. This is the topic of today's video. Although it may seem surprising, in most cases, your body will give subtle signs before a silent heart attack occurs. Want to understand better what a silent heart attack is and learn about the 6 signs you should not ignore? Then stay with us until the end of this video, because it is extremely important and could save your life or that of someone dear to you. Heart attacks are one of the leading causes of death worldwide, and cardiovascular diseases claim approximately 400,000 lives annually, according to the International Cardiology Society. It is crucial that we stay alert. But before we continue, make sure to like this video. Let's make this video the most liked on the channel. The more likes it gets, the more YouTube sees it as relevant content and shares it with more people, helping to raise awareness. Subscribe to the channel if you haven't already, and activate the notification bell. Also, share this valuable knowledge with your friends and family. Did you know that less than 5% of the population can recognize the symptoms of a heart attack? That makes raising awareness even more important. Now imagine how many people know about silent heart attacks. Almost no one. That's why it's so important to share this video. With your help, many lives can be saved. And tell me, have you ever experienced a heart attack? Do you know someone who has? Where are you watching from? Leave your comment below. 6 signs of a silent heart attack you shouldn't ignore. Let's get started. Is a silent heart attack different from a regular heart attack? The answer is yes and no. Both have the same underlying cause, but the symptoms are what truly differ. The heart is a muscle that requires a constant supply of blood rich in oxygen and nutrients to keep pumping blood throughout the body. In a heart attack, a coronary artery that supplies blood to the heart gets blocked, disrupting blood flow. The main cause of a heart attack is the buildup of fatty plaques in the arteries, commonly known as atherosclerosis. These plaques can rupture for several reasons, such as stress, cold exposure, intense physical exercise, or even heavy exertion, like moving heavy furniture. When a plaque ruptures, platelets, which are blood components responsible for clotting, try to seal the rupture, forming a clot. This clot, inside a narrow artery, can grow until it partially or fully blocks the artery, leading to a heart attack. When this occurs, the heart muscle begins to suffer because it does not receive the blood it needs to supply oxygen and nutrients. Heart cells start dying quickly. The severity of the heart attack depends on the affected artery, whether it's a major or minor artery, and whether the blockage is near the beginning of the artery or further away. Additionally, how quickly the person arrives at the hospital and receives treatment directly affects the severity of the damage. This is why a silent heart attack is especially dangerous. Without obvious symptoms, a person might not even realize they are having a heart attack. This is concerning because it means they are less likely to seek medical help immediately, which is critical for preventing serious heart damage. The classic symptoms of a typical heart attack. What are the classic symptoms of a heart attack? Less than 5% of people know how to identify them, so it's worth reviewing. Chest discomfort, a chest pain that lasts for several minutes and may come and go. This pain is often described as pressure, heaviness, tightness, or burning. Pain radiation. The pain isn't limited to the chest and may extend to the left arm, back, neck, jaw, stomach, or both elbows. Shortness of breath. This may occur along with chest discomfort or independently. Cold sweat and paleness. Due to the discomfort, the body releases adrenaline, leading to cold, clammy sweat and paleness. Nausea and vomiting. These are caused by the activation of the vagus nerve. Dizziness and fainting. Lack of oxygen can lead to dizziness and, in severe cases, fainting. Anxiety. Many people describe a feeling of panic, like something terrible is about to happen. These are the classic signs of a typical heart attack. But what about a silent heart attack? This is a more complicated situation because the symptoms can easily be confused with minor health issues and may be ignored. A silent heart attack may not cause chest pain, numbness, or shortness of breath. What are the risks of a silent heart attack? A silent heart attack comes with additional risks. Since many people don't realize what is happening, they are less likely to seek treatment, which increases the risk of heart failure, stroke, and even a second heart attack. Risk factors for a silent heart attack. Just like a typical heart attack, a silent heart attack is related to several risk factors, including smoking, diabetes, high blood pressure, overweight and obesity, sedentary lifestyle, lack of regular physical exercise, high cholesterol, low HDL or high LDL, the bad cholesterol, inflammation, age. Postmenopausal women over 55 and men over 45 have a higher risk. Family history of heart attack or stroke. Among these factors, diabetes deserves special attention. Diabetes can silently damage the nerves in the body. This is why people with diabetes have a higher risk of experiencing a silent heart attack. The pain that would typically be felt during a heart attack may not occur in people with diabetes, as if the heart's nerves are numb. This means the body's natural warning alarm isn't triggered, making it harder to recognize and seek treatment. 6 signs of a silent heart attack that should not be ignored. Now, let's discuss the signs that, despite being subtle, should never be ignored. 1. Persistent fatigue. A person may feel extreme fatigue or general malaise, which is often mistaken for overwork, lack of sleep, or simply aging. Many women may think this tiredness is due to a passing viral infection. However, if you have risk factors, it is essential to take this fatigue seriously. Don't ignore it. Seek medical attention to have an electrocardiogram and cardiac tests that could save your life. 2. Mild chest discomfort. Unlike a classic heart attack, a silent heart attack may only cause mild discomfort in the center of the chest. This sensation can easily be mistaken for gas, heartburn, reflux, or indigestion. If you feel that something isn't right, don't ignore it. Seek medical attention immediately. 3. Unexplained sweating. If you start sweating for no apparent reason, without being in a hot environment or exercising, it could be a sign of a silent heart attack. This symptom is particularly significant for people with diabetes. Do not ignore sudden cold sweat. 4. Shortness of breath. Feeling out of breath after minimal effort, like climbing just a few stairs, could be a sign that your heart is not pumping blood efficiently. Shortness of breath is a common sign of a silent heart attack and can occur without chest pain, especially in women. It may also be accompanied by dizziness or vertigo, which can lead to fainting. 5. Nausea. Many people think they are just experiencing indigestion, a virus, or even the flu. However, sudden nausea, especially if accompanied by cold sweat or chest discomfort, can be a sign of a heart attack. 6. Discomfort in other parts of the body. Mild discomfort can occur in the jaw, stomach, neck, where there may be a sensation of pressure in the back. Since these symptoms are mild and different from a classic heart attack, they are often ignored, but it is crucial to pay attention to them and seek medical help if needed. I have treated many patients who came in for a routine consultation, unaware that they had experienced a heart attack. When we perform an electrocardiogram, it becomes clear that there is a scar, a fibrotic area in the heart, indicating a previous heart attack. This highlights the importance of not ignoring symptoms, even if they are subtle. The sooner it is identified, the greater the chance of effective treatment and avoiding permanent heart damage. How to prevent a heart attack? Now, an important bonus for you: how to protect yourself from a heart attack. Yes, there are ways to protect yourself. If you've already had a heart attack, you're at a higher risk of having another one. This means that it is essential to visit a cardiologist regularly and strictly follow the prescribed treatments, including medication. There are no miracle substitutes like magnesium chloride or vitamin K2 that can prevent another heart attack. What we know, based on scientific evidence, is that the right medications significantly reduce the risks. If you've never had a heart attack, there are steps you can take to reduce your risk. Attack the risk factors. Lifestyle changes are essential. For example, quitting smoking can reduce your risk of a heart attack by up to 30%. Keep your blood pressure under control. Ideally, your blood pressure should be at 120/80. Control your diabetes. If you have diabetes, keep your blood sugar well controlled, with an HbA1c of less than 7. Eat healthily. The Mediterranean diet, rich in olive oil, nuts, and fish, has been shown to be better for reducing heart risks than a low-fat diet, according to a study from 2022. Reduce cholesterol and triglycerides. If diet and exercise aren't enough, don't hesitate to use the necessary medications. Exercise. Get at least 150 minutes of moderate physical activity per week. Get good sleep. 7 to 9 hours per night is recommended. Lose weight. If you are overweight or obese, losing weight can significantly reduce your risks. Create new bonds and friendships. Loneliness and social isolation can increase your risk of a heart attack by nearly 30%. Get regular cardiological check UPS. If you have many risk factors, advanced tests such as a coronary CTA can be important to prevent future problems. I hope you found this video helpful and learned something new. Don't forget to share this information with others, as this knowledge can save lives. Many people write to me, saying that if they had seen videos like this sooner, they might have been able to prevent the loss of a loved one. Share it now. Don't let this opportunity pass by. And let me know what will be the next video you will watch. I'll leave 2 suggestions here. What happens when you eat EGGS daily for 30 days? And Heart Expert reveals 7 surprising signs of poor heart health. This is the channel Health First. Remember to subscribe to the channel and see you in the next video. Thank you very much.